What I am trying to do in my presentation today is give you some overview of some of the data sources, at least to go through a couple of the ones that weren't discussed already, and also to highlight an example of how multiple data sources have been used. Okay. So I have no conflicts. And these are our objectives for today, for this part. I'll go over each of these, and I will try to be on time so we can have some time for questions. So let me start first with describing some of the data resources and assets and methods available in the VHA for comparative effectiveness research. I probably should say a little bit about what comparative effectiveness research is. Sometimes we take for granted. Basically, it's not efficacy research. It really includes a large range of research types. It can be clinical trials, it can be observational, it can be retrospective, it can be prospective. It can also be case studies. But it tends to look at current evidence about efficacy and to inform healthcare decisions. Sometimes we call health services research comparative effectiveness research. Sometimes in the past we've called it outcomes research. We've even used the term implementation science, which picks up realms of that. So different terms can sometimes be used interchangeably. But the bottom line is it's not looking at efficacy. In the VA, there are many data sources that can be used in cancer comparative effectiveness research, from administrative and operations data, clinical data, which we've heard quite a bit about, which can be in different types, structured and unstructured, meaning text, financial data, but there's also primary data that are collected directly from veterans in surveys, interviews, that can be both research and non-research, as well as data from other agencies. I really want to make sure that you pick up on some of the resources I'll be highlighting today, and I'll go through them pretty quickly, but hopefully you'll be able to see some of the websites and resources if you take a look at these slides afterwards. The VHA Corporate Database Monograph, which is actually produced by National Data Systems, the office that Charlie Stroop is a part of, is produced pretty much every year. And it goes through a lot of the corporate or national databases and provides some basic information about what those data contain, the contact information, and some key elements. And I would strongly recommend that you take a look at this when you're trying to plan projects, whether they're research or non-research, and what data assets are around. It includes 139 databases and information systems. It's only available on the intranet. 139 is only a smidgen of the data assets that are available, but this is a really good start. National level VHA data is what I will focus on. I will not talk about electronic health record data or some of the local databases, but there are many of those as well. National level VHA data include inpatient and outpatient workload data, Medicare and Medicaid enrollment data as well, DSS, decision support, clinical extract data, I'll talk a little bit about that, some pharmacy data, vital status or whether someone has died, their current status, financial data, and I will not be talking about the corporate data warehouse since Scott and Charlie did a great job on that. I want to just go through a couple of these. As I go through these, I'm just going to give a couple of remarks, and I'll talk a little bit more about it when I give an example of a research project. The decision support clinical national data extracts, we're now calling them MCA, I believe, financial reporting, but these are now part of the corporate data warehouse. These I highlight in particular because for those of you who are doing research across many VAs or many patient populations, you have this asset that's available to look at information about laboratory test results, the fact that particular tests were done across many VAs and a large patient population, as opposed to one by one going through an electronic health record doing medical chart reviews. This was a huge improvement in terms of a data asset that was added when DSS was constructed. And now it's integrated with the clinical data, corporate data warehouse. So it can make it a little bit easier to integrate data from other sources. The kinds of information that are available in it are just incredibly valuable. And for those of you who try to do projects or research in places other than the VA, you will, if you haven't, you will come to appreciate even more the incredible assets that we have available to us in the VA because veterans are willing to come to the VA and make these available to us. These are not available in many other places, especially in universities. Detailed information about who the provider is, who are ordering tests, the kinds of tests, and particular data sets we actually have information about the test results. This is where structured data is really the value here. And this information, you're going to see a couple websites on here. Substitute www with our VA www. They're all inside the intranet now. VA pharmacy data, these are medications dispensed from VA pharmacies. It's managed by the Pharmacy Benefits Management, but there's also data in the decision support system as well. So we have multiple sources of pharmacy data. You can get information about the generic drug name, day supply, VA drug class. You can also get information about the SIG or the frequency and the ordering information from the Pharmacy Benefits Management database. And there's lots of resources about this. The VA Vital Status data set. This is a really important data set to use. It combines multiple resources from the Veterans Benefits Administration, the Beneficiary Identification Record Locating System, which keeps track of all the veterans who are enrolled in the VA and their status. Are they alive? Have they died? Dates? Where? It also includes information about VHA workload because the VHA workload data also has a vital status indicator. Information from Medicare and the Social Security Administration are also included here in terms of indicators of vital status. And there's different types of file structures that make it easier to get at information and recommendations on best sources of vital status as well. The vital status data set was constructed with both operations and research in mind, and it has information about the different sources tagged as best, and it also includes information about the last healthcare utilization date. It's also managed by national data systems as well. We talked a bit about the corporate data warehouse. I just want to point out that there are some resources on the VIREC website. I'll highlight that more at the end. But just so you have a better understanding, warehouses are pretty common around healthcare institutions over about the last 10 years. And it's really just a different way to structure data that makes it more efficient. They're relational databases, and there are training resources if you find yourself in need of working directly with some of the corporate data warehouse data. They're extremely useful. They are a wealth of information with data going back to 1999. And as mentioned, they are updated very frequently. Just some examples of the kind of domains that Charlie and Scott mentioned. Vital signs. Nowhere else can you get information about vital signs. And you can get a lot of information about vital signs. Those of you who work in ICUs and surgery, all those blood pressures are in the corporate data warehouse. It's up to you as a user to make decisions about what's the most useful information. But all those events are there. Immunization, health factors such as smoking, for example, laboratory results, and this is just a very short list. And again, managed by national data systems, and there's great details about this information on many websites. VIREC is one. I also want to highlight data sets that weren't mentioned yet that we actually happen to manage at the VA Information Resource Center, VIREC. That is Center for Medicare and Medicaid Services data. There's actually two offices that manage these data. I have to get my acronyms right, VHA, Assistant Deputy Undersecretary for Health for Policy and Planning, manages the coordination between the agencies, CMS and VA. And we're thrilled to have these data available to us since 1999. This was a very long process with making information available that started in '99, and we've been having this very good working relationship since then. The data are managed by the Medicare and Medicaid Analysis Center as part of the ADUSH-PP in Boston. They manage operational use of these data. And VIRIC manages the research use of these data. It includes enrollment in Medicare or Medicaid. It also includes enrollment in information in carve-out programs that Medicare has, such as the end-stage renal disease program. It also has information about individuals in long-term care as well. And it's claims data. So it does not have the wealth of clinical detail that we often rely on in electronic medical records, or even workload data sometimes. It has a lot of information that includes ICD-9 and billing code data, the current procedural terminology codes, and ICD-9 diagnosis codes. It can be used for many kinds of projects. It's been used in operations projects as well as research projects over these many years. And because of the long period of time for which we've been accumulating data, it's also very useful for longitudinal studies. And because of the way the data are structured, I want to point out that all of these data sets that I've talked about use the same, I won't call it a master patient index, but it includes information that allows linking across all the data sets without necessarily using social security number. So all of these data sets can be brought together in one research project. I also want to mention the Health Economics Resource Center, another health services research and development center based at Palo Alto. They manage, they develop and establish data sets that focus on costs and financial assets that the VA has that are also linked with workload data in the VA. The average cost data set is an important one, and they have done some work with the decision support system and some of the financial management system. And when I say they've done work with it, they've created information guides so you know how to use it that are beyond the technical guides that the data architects use. These are user guides. But they also have an actual data set that they've constructed that's very similar to what Medicare uses in terms of estimating costs for veterans receiving care in the VA. I would like to highlight just one research example to just show you how some of these data assets can be integrated. It's not a real recent study, but it's actually a study that's going on for a long time. It's called the VA Colon Cancer Quality and Cost Study. It looked at a couple different, we actually had 4 aims that looked at healthcare use all the way to survival. I'm going to talk a bit about just some aspects that we use to look at healthcare use and the healthcare cost in cancer treatment in both VA and Medicare. Many people were involved in this project over many years, and we're continuing to publish